The Federal Capital Territory Administration has applauded its performance in the Health Assessment Report Scorecards, describing it as a positive indication of the holistic approach by the Barrister Nyesom Wike's led administration in improving the overall healthcare system within the FCT. FCT Mandate Secretary for Health, Dr. Adedolapo Fasawe, represented by the Permanent Secretary, Dr. Babagana Adam, made these remarks to newsmen at the recently held dissemination workshop for the Joint External Evaluation Report. Daniel Obi brings us details.
The Joint External Evaluation Report, using a baseline calculation tool with minimal margins of error, assesses health security capacities at the subnational level. The report highlights the FCT's strengths and weaknesses in detecting and preventing public health threats. Representative of the FCT Mandate Secretary, Dr. Babagana Adam, posited that in spite of the FCT's healthy scorecard, the administration would not relent as there are ongoing plans to improve on the areas of weaknesses.
The reason why we have this meeting is the plan for us to improve on our areas of weakness. And as you can see, the response of the stakeholders is that the involvement of all other stakeholders that are not here to do an action plan, according to the state epidemiologist, is to draw an action plan to address all the areas of strength and weakness and make it better. So we assure you that by our next report, you see the action plan that will be done and evidence provided to deliver.
Also speaking, Dr. Lawal Lukman Ademola, the FCT state epidemiologist, took time to explain the efficiency of the tool deployed in the assessment.
So it is not, I won't say there's a margin of error. So we all agreed. It's an international tool that was agreed to say, okay, these areas are what we'll look at ourselves at and what we'll use to score ourselves. And you should also know that the peculiarities of this document is that it is an all or none. So if 5 things are listed in 1, if you've done 4, even if you've done the 5/5 in 2, if you've done the 5/5 in 3, you'll still be asked to go back to assess yourself as a score of 1 because you've gotten 4/5 in 1.
Dr. Rukayat Wamako, the Executive Secretary of the FCT Primary Healthcare Board, spoke on the efforts of the board in vaccinations against immunizable diseases.
There is nothing like magic there than to work on it. You see, the surveillance of the disease as well as to go and vaccinate were hand to hand. As they survey that there is an outbreak of this or there is an anticipation of an outbreak, and then we also go into that community and then immunize based on the findings they have.
According to the JEE report, the FCT was rated high on immunization coverage, vaccine access and delivery. The FCT's surveillance system and reporting network was also commended for its effectiveness. However, recommended areas for improvements includes the use of electronic tools and surveillance data analysis. The FCT equally demonstrated a strong case management capacity for health security related events and emergency operations centers capacities, procedures and plans. Daniel Obi, ASO Television News.